Good afternoon. Our lecture for this afternoon would be on mental health program. Mental health and well-being is a concern of all. Addressing concerns related to mental, neurological, and substance contributes to the attainment of the Sustainable Development Goals through a comprehensive mental health program that includes a wide range of promotive, preventive, treatment, and rehabilitative services. That is for all individuals across the life course, especially those at risk of and suffering from MNS disorders. This is integrated in various treatment settings from community to facility that is implemented from the national to the barangay level and backed with institutional support mechanisms from different government agencies and CSOs. We hope to attain the highest possible level of health for the nation because there is no universal health care without mental health. The mental health program envisions a society that promotes the well-being of all Filipinos, supported by transformative multisectoral partnerships, comprehensive mental health policies and programs, and a responsive service delivery network. Its mission is to promote overall wellness of all Filipinos, prevent mental, psychosocial, and neurologic disorders, substance abuse, and other forms of addiction, and reduce burden of disease by improving access to quality care and recovery in order to attain the highest possible level of health to participate fully in society. Program components will be making sure that wellness of daily living is ensured. All health, social, poverty reduction, safety and security programs, and the like are protective factors in general for the entire population. So promotion of healthy lifestyle, prevention and control of diseases, family wellness programs, etc. And school and workplace health and wellness programs. Extreme life experience takes the provision of mental health and psychosocial support during personal and community-wide disasters. Mental disorders, neurologic disorders, and substance abuse and other forms of addiction have provision of services for mental, neurologic, and substance use disorders at the primary level from assessment, treatment, and management to referral, and provision of psychotropic drugs which are provided for free. Enhancement of mental health facilities under HFEP. There are policies and laws that encompass the mental health program. Order number 8 is the National Mental Health Policy. And there's a revised operational framework for a comprehensive national mental health program. And RA 11036 is the Mental Health Act. Different strategies, action, and points of timeline would focus on governance, service coverage, advocacy, evidence, and making of regulation and laws. Accomplishments of the program would be the passage of RA 11036 dated June 20, 2018, which is an act establishing a national mental health policy for the purpose of enhancing the delivery of integrated mental health services, promoting and protecting the right of persons utilizing psychiatric, neurologic, and psychosocial health services, appropriating funds therefore and for other purposes. DOH Administrative Order dated October 28, 2016 is the revised operational framework for a comprehensive national mental health program. So this is included in the National Health Program Strategic Plan 2018-2020. So there's a harmonized and mental health training manual, development of the implementing rules and regulation of 11036, conduct of the advocacy activities, training on mental health gap action program, conduct of the national prevalence survey on mental health, and establish of the medicine access program for mental health. So September 10 would be World Suicide Prevention Day, October 10 would be Mental Health Day, and the second week of October is a National Mental Week. So the WHO estimates that 154 million people would suffer from depression. About a million would suffer from schizophrenia. 877,000 people die by suicide every year. 50 million would suffer from epilepsy, 24 from Alzheimer's and other dementias, and 15.3 million persons with drug use disorders. So in the Philippines, the WHO study, up to 60% of people attending primary care clinics daily in the country are estimated to have one or more mental, neurological, and substance abuse disorders. The Census of Population and Housing showed that mental illness and mental retardation ranks third and fourth respectively among the types of disabilities in the country. Data from the Philippine General Hospital show that epilepsy accounts for 33.44% of adult and 66.20% of pediatric neurologic outpatient visits per year. So drug use prevalence among Filipinos aged 10 to 69 years old is at 2.3%, or an estimated 1.8 million users according to the DBP 2015 National Survey on the Nature and Extent of Drug Abuse in the Philippines. The WHO Global School-Based Health Survey has shown that in the Philippines, 16% of students between 13 to 15 have ever seriously considered attempting suicide, while 13% have actually attempted suicide one or more times during the past year. The incidence of suicide in males increased from 0.23 to 3.59 per 100,000 between 1984 and 2005, while rates rose from 0.12 to 1.09 per 100,000 in females. Intentional self-harm is the ninth leading cause of death among the 20 to 24 years old, and a study conducted among government employers in Metro Manila revealed that 32% out of 327 respondents have experienced a mental health problem in their lifetime. Based on global epidemiology on Kaplan and Sadak synopsis of psychiatry, schizophrenia, 1%, 1 million. Bipolar, 1%, another million. Major depressive disorder, 17%, so that's 17 million. Dementia, 5% of the folks older than 65. And epilepsy, 0.06%, so that's 600,000. So it's important to bear in mind the mental health state of one person, because you do not know, one person may seem okay but may be having troubles inside. So take home point, always be kind, always choose to be kind. Thank you for listening to this lecture. This is our Preventive Medicine and Community Health lecture. Subscribe to our channel for more lectures on PMCH.